highlighted, Cardiocon is all about crisp, to the point deliberations. This year we have 9 clinical case scenarios, and we'll be discussing each one of them to the point with the questions, no theory, what is the prevalence, what is the etiology, nothing doing. I have some problem, this is the thing that I face, how do I tackle it? For example, I often give this example, I have a patient on SGLT2 for diabetes, develops UTI, when do I start, I don't start, when to re-challenge, not to re-challenge, that's one. And most of the clinical scenarios that we have created are on that format only. So the whole discussion is about. This year we have included one thing that's going to be changing your practice. Cardiocon has always been at the front seat of bringing the debates that were of topics that were not in the market. For giving an example, when people were discussing, we were talking about left main angioplasty with the CABG debates in the first Cardiocon. When people were not considering antiplatelets amongst themselves as debate, we were discussing it. When Tower came, we were debating about transcatheter aortic valve versus surgery as an option, as a debate. Last year, when the synopsis happened, we were discussing anti-anginals when the Merlin-Timmy was out, but trimetazole was not yet out in stable coronary artery disease. All of these evidences have later on come. Today, again, we will be discussing one of the therapies which is going to be discussed for the first time in any conference, which is Lokelma, which is sodium zirconium cyclosilate, which is nothing but pentiromer, easily available in US. It's going to be available now in India. How we all end up chasing hyperkalemia as a problem. You give ACE, you give ARNI, you give anything, patient gets elevated potassium. How do you manage it? So typical clinical case-based scenarios, how to chase low eGFR and heart failure, how to match the two. Again, Ahmedabad is becoming a hub of heart transplant. So in that scenario, which patient, especially now we have dilated cardiomyopathy, severe LV dysfunction, which patients should end up with transplant, which patients can get newer therapies like MitraClip, MyValve, MyClip. And now recently the data was published about transcatheter mitral valve replacement. You just do a balloon mitral valve. What the mitral valve 1 year data is out, and I think that is again going to change the therapy. So right across, same way, we all know acute pulmonary embolism, severe hypotension, you do thrombolize. But intermediate, lot of times you don't thrombolize. But very importantly, this year we have included a session on genetics and AI. That's the first session that we'll have. As you know, genetics and AI is one aspect which is going to again change practice in next couple of years, and that's what we are trying to focus and think to be bringing through Cardiocon synopsis as something that you would be trying to nurture and nourish and inculcate your insights into choosing a therapy or not choosing a therapy based on artificial intelligence, which is never going to miss any evidence in medicine, which you may forget because you are tired, you saw too many patients, because you have not read, etc., etc. So AI will always, 1,000 times you'll ask, it will only improve. It will give you 2 more evidences. It will never be outdated. It does not need a recertification of CME to be attended by any medical council. It will always be at the front bearer. And same is happening with genetics. As you evolve with younger patients and you want to intervene at early stage. We were discussing amongst cardiologists how when we were doing our residency, intention was કે MI થઈ ગયું છે એટલે હવે LV dysfunction ના થાય એના માટે કંઈક કરીએ. Then step came કે MI થાય એના પહેલા કંઈક કરીએ. Then we started talking, let's treat diabetes so that MI જ ના થાય. Now we are talking obesity treat करो diabetes ना થાય. I think now we will reach a stage where you want to intervene before obesity ना થાય, or for that matter you pick up a person who is genetically primed with artificial intelligence, with the current available evidences, that you intervene so that the patient does not end up with the disease. So that's where the whole science is progressing in next 5 or 10 years. That's how the science scenario or clinical scenario of clinical medicine is evolving. As from history, people were moving to stethoscope. From stethoscope, they were moving to echo. From echo, they moved to cath. I think AI is going to bring you back to history.
It will tell your diagnosis based on what complaints you will tell. It will rely so little on investigation. It will be 90% of the time still be able to tell you what you're dealing with based on history itself, and then suggest you appropriate investigations. So that's the whole changing paradigm in clinical medicine. That's where the science is headed. This discussion apart, as we await our chief guest, Sri Rajendra sir, to be here any moment for lamp lighting and Saraswati Vandana ceremony, I would open the forum. We have elite professors here amongst us to discuss if any suggestions and points we have. I think Madhava is involved pretty much in AI and also academics. Any suggestions on AI? Whether your inputs? I think he's going to be there in the next session. We should not. Uh, right, Jayeshwar. So your inputs on Mike? Yeah.
For yesterday only, there was a meeting in Delhi, GBT. The Government of India started a very promising project to do the genome sequencing of 1 million population. It's called as a National Genomic Database. And the target is that completing the project in 4 years' time. I was one of the expert members there from Gujarat. There are 20 members across the country. So we have to do 1,000 exomes per day. And by the end of the 4 years, as you say the AI, how to integrate, because right now what we use the reference genome is from the Western country. We don't have our own. Okay, I see. Yes, sir. Yes, yes, yes.
Maybe one welcome, Sri Rajendra sir. What do you do?
Round of applause for sir. I would request Dr. Kamal Sharma to welcome Rajan sir. I would request Dr. Mukesh Ladda to welcome Dr. Nitin Shah. I would request Dr. Priyanka to welcome Dr. Nikhil Sadhu. I would request Dr. Ansi Shah to welcome Dr. Bhagirat Solanki. I would request Dr. Shardul Chaurasia to welcome Dr. Pritesh Shah. I would request everyone to stand up for Saraswati Vandana and lamp lighting ceremony.
या कुन्देन्दु तुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसारपरमा आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदाम् जाड्यान्धकारापहाम् हस्ते स्फाटिकमालिकां विदधति
I would request Rajendra Shah to bless us with words.
Very good morning, dear doctor friends.
First of all, I convey my thanks to organizing committee of today's
To allow us to sponsor the event. Telling to Dr. Kamal Sharma.
I'm also thankful to all the association to support this kind of event, to spreading the knowledge. So I welcome
Dr. Nehal Sadhu, Dr. Solanki, Dr. Shah, and Dr. Kamal Bhai and team, our Dr. Nitin Bhai, Sadul Bhai, Priyank Bhai, all distinguished guests. Today is Sunday and everybody wants to enjoy the holiday, but we have called you here and thanks to coming, attending this great event of Cardiocon. I'm thankful to Dr. Kamal Sharma. He's taking great pain to organize such event which is really useful to the society. આપણે ગુજરાતીમાં કહેવત છે ને કે જ્ઞાન
વહેંચો એટલું વધે. And this is the best example what we are spreading our knowledge to the society among other people. What my experience I will share with the people and people will get the benefit, society will get the benefit. So this is the best noble cause. So I always support this kind of event which is really useful for the society. The best part is in last so many years I have observed we have come across so many things, so many new things which has expanded lifespan of the people. If you go back to 40 years, 50 years, 60 years, when you reach 60, you feel I am old and I have finished my work. And people will used to get old. I don't know why, but at the age of 60, લોકો જાતે જ એવું કહી દેતા કે હવે અમે ગઢા થઈ ગયા. તમારા અતુલભાઈ જોઈ લો. He never feel that he must be more than 70, but he never feel that I am old. Same Amara Harshabe. So this is the, because of science, because of doctors and research, we have added life to the people. So great change in India in last 20 year or 30 year or 40 year. We have 20 year in the life of the people. So great work done by our doctors. I was comparing sometime with the global scenario in healthcare sector, that where we stand and where they stand. You will surprised to note so many countries claim that we are developed countries and we have so many things. We are spending so many budget for research and healthcare and so many things. You look at US, you look at UK, but I tell you one thing. We are far ahead of them. There you fall sick, you will get the appointment after 10 days. Here, not me, my driver can walk down and can get services in 5 minutes. So there is great change. We are giving such a wonderful healthcare services in our country. There is no comparison. One more thing, it is most affordable. સામાન્યમાં સામાન્ય માણસ હોય પણ કોઈ પણ જાતની એને જરૂર પડે તો પૈસા માટે થઈને એને ક્યાંય નથી રોકાવું. The best part, anybody can get cancer થયું છે, you don't have money but you will get that. And thanks to our honorable Prime Minister Narendra Bhai, he has introduced PMJ, and in PMJ such a great services they are getting, and very good hospitals like Sterling, like SAL, like SIMS, they are empaneled with. So normal people won't get these services in that case, but they are getting the services. So in healthcare sector, we are definitely much ahead than the developed country. So that whole credit goes to our doctors also. I find that you can approach any doctor on phone call. Nobody will refuse to talk to you. Whatsoever great he must be, he will definitely answer. I have observed in my last 25-year career in this healthcare sector. But કોઈ ડોક્ટરે તમે ફોન કરો, કમલભાઈ હોય કે સાધુ સાહેબ હોય, કોઈ પણ હોય, ક્યારેય ઇરિટેટ નહીં થાય અને ક્યારેય ગુસ્સે નહીં થાય કે મને કેમ ફોન કર્યો. સેમ થિંગ યુ ગો ટુ US, તમારે એના સેક્રેટરીને મેલ કરવાનો, એને ટાઈમ મળે, ફુરસત મળે ત્યારે સેક્રેટરી મેલ વાંચે, પછી એના બોસને ફોરવર્ડ કરે, 2 દિવસે એનો બોસ વાંચે, ત્યારે તો તમારી હાલત શું થઈ હોય ગોડ નો. So this is the system what we have adapted. Humanitarian approach of our doctor is great. બહુ જ સરસ, અને સૌથી આઈ થિંક વર્લ્ડમાં બેસ્ટ જો ડોક્ટરોનો એપ્રોચ હ્યુમેનિટેરિયન હોય તો that is India. Best, I appreciate. Kamalbhai is working very hard in research, so many papers he is publishing, number of doctors must be publishing, and I think that is the need of the days today. Research can change entire world. Whole thing is research, new development, new invention. New invention can lead your country to anywhere. If you look at UK, if you look at USA or any other developed country, their main base is research and development. Here, let me put you like that. We are lacking somewhere. We are doing great job. Say, per day, 50-100 patient આપણા ડોક્ટરો જુએ છે. They have great knowledge, but આપણે એનું રેકોર્ડિંગ નથી. We don't record કે મેં આપ્યું અને એનાથી આ બેનિફિટ થયા. આપણે પેશન્ટ આવ્યો, જોયું, દવા આપી, સારો થઈને ગયા છે. બીજું પેશન્ટ આવ્યું, દવા આપી, સારો થઈને ગયા છે. We don't record it. The difference is, if we record this, then end of the month, end of the year, we can know કે આપણે શું કર્યું અને એના રિઝલ્ટો શું. So many things આપણે ઇન્વેન્ટ કરી પણ હોય પણ ખબર નથી. So history taking and recording is the need of the day. અને અત્યારે એટલું બધું રિસર્ચમાં આગળ વધ્યા છે લોકો કે આપણે we also can do a lot. I will request all doctors that let us start with this. Research and development એટલો મોટો એરિયા છે કે બહુ જ કામ થશે અને આપણી પાસે પેશન્ટ છે. ખાલી એની ડેટા બેંક આપણે મેન્ટેન કરવી પડે. That's it. And there is number of good institute who can support you in doing this also. એટલે financial burden પણ નહીં આવે. Like Torrent, Zydus, so many good institutes are there. They can support you in research and development. So આ major area છે કે જેમાં research અને ડેવલપમેન્ટમાં આપણે ખૂબ આગળ વધીશું. અને નવી ટેકનોલોજી તો હવે જબરજસ્ત આવી છે. એવરીબડી નોઝ અબાઉટ ઇટ. આર્ટિફિશિયલ ઇન્ટેલિજન્સ થી we can change the world. મારા કમલભાઈ બહુ કામ કરે છે. But it's a next generation development will be there. અને એટલી બધી વસ્તુઓ આપણે શોધી શકશું અને એની પર કામ કરી શકશું કે આખું વર્લ્ડ બદલાય. અને જ્યાં જ્યાં ઇન્વેન્શન થયા છે, they have always lead up. You look at આપણી રાજાશાહીઓની પાછળ જાઓ ને તમે, તો તમે you go back to the history કે ભાઈ મોગલો આયા, they ruled upon India because they were cruel and આપણે અહિંસામાં માનનારા લોકો હતા અને એ લોકોએ રાજ કર્યું એ તો બરાબર છે. એ પછી એવા હિંસક લોકો ઉપર પણ અંગ્રેજો આવ્યા. તો અને 50 લોકો આવીને they ruled upon Mughal and India. How it can be? Only because of technology. પહેલા રાજાઓ કોટ બનાવીને બેસી જતા, એની અંદર કોઈ આવી ના શકે એટલે બસ we are fine. એ લોકો તોપ લઈને આવ્યા પહેલા ઇંગ્લેન્ડ. ગમે તેવો તમારો પેલો એ હોય કિલ્લો 5 મિનિટમાં તોડી જાય. ત્યાં રૂલ પૂરા થઈ. તો વર્લ્ડ ટેકનોલોજી 200 વર્ષ ગુલામ રહે. So invention, I'm again pressing upon. The invention can rule upon the world. And we have a lot of opportunities.
opportunity, you try. Financially, there is lot of institutional today available. કેટલી બધી ઇન્સ્ટિટ્યૂટો આપણા ગુજરાતમાં પણ છે. Who can support? અમારી પાસે પણ બજેટ છે. એટલે બજેટ ઇઝ નોટ પહેલા તો શું હતું કે બજેટ જ નહોતા. કોઈને સ્પેન્ડ કરવું હોય તો કરી જ ના શકે કે બિચારો પહેલા બે છેડા પોતાના ભેગા કરે પછી ઇન્વેન્શનની વાત આવે. પણ અત્યારનો જમાનો સમય બદલાય. So let us work hard on new invention. Let us change the history. Kamalji, all the best. And I wish you all the success. Thank you very much.
Thank you, sir, for such a thoughtful and inspiring speech. Now, let's start our scientific session. And over to Dr. Kamal Sharma.
So thank you everyone for being here on the inauguration function, and it's always a pleasure, sir. Rajendra sir's blessings. He's been a mentor, handholder, guide, senior father figure, elderly brotherly person who has always mentored us, guided us, and always has shown us the path. More importantly, what he's told us, that it's the intent and the honesty that matters. How you do, how you execute also matters, but it's your intent that always holds the truth. And that's what we always keep as a mission in ourselves. Thank you very much, sir, for your kind words. Thank you very much, all the dignitaries on the stage, for the inauguration function. Thank you.